Hello dear colleagues, the following video demonstrates a relatively rare clinical presentation post-cataract surgery. Mr. M.I., a 57-year-old male, walked into my clinic one fine morning in January 2023 with complaints of sudden onset painless diminution of vision of the right eye since one day. He had undergone right eye uneventful phacoemulsification with Alcon-Acrisof IOL implantation in October 2011 at the young age of 43. He subsequently underwent left eye phaco with same IOL implant in 2015. He had no history of trauma, fall, use of any eye drops, intravitreal interventions, or any systemic diseases. His uncorrected visual acuity was finger counting close to face in the right eye and 6/6 in the left eye. He had a normal intraocular pressure. His slit lamp examination revealed right eye aphakia with rest of the anterior segment being normal. His left eye was pseudophakic. To my shock and horror, he had a posteriorly dislocated IOL in the right eye. This was an unprecedented situation. A relatively young patient had spontaneous dislocation of IOL with no preceding risk factors. He underwent right eye IOL explantation with full vitrectomy with implantation of a 3-piece IOL in the sulcus as seen in this video. He recovered his vision to 6/6 post-operatively. Based on literature review, a search for the likely cause of this situation revealed following facts. This was a case of in-the-bag IOL dislocation, essentially due to zonular apparatus capsular bag insufficiency with likelihood of being dead bag syndrome. Dead bag syndrome is one of clinical entities in a broad spectrum of IOL lens dislocation labeled as zonular apparatus capsular bag disorders. The defining features of DBS, or also called dystrophic bag syndrome, are mid-dilated pupil, phacodonesis, subluxation or complete dislocation of IOL with the bag. The capsular bag is very thin, diaphanous, lacking fibrotic changes with complete absence of lens epithelial cells. Absence of any risk factors like pseudoexfoliation, true exfoliation, myopia, intraocular surgery other than the cataract surgery, trauma, to name a few. Typically, this dislocation presents 8+ years after the primary surgery. The pathogenesis of DBS is still not very clear, but histological evidence suggests in an open bag, the aqueous, which gets access to the lens epithelial cells, prevents fibrosis by inhibiting lens epithelial cell proliferation, affecting long-term functioning of these cells. Another possible hypothesis for this rare syndrome could be that genetically susceptible patients have their zonular matrix metalloproteinases activated by the use of topical or intracameral fluoroquinolones at the time of cataract surgery. Histopathology of these capsules revealed that scars or no epithelial cells were present in the capsular bag and suggested that cells were present after surgery, secreted components of fibrotic posterior capsule opacification, and later died or detached. A split in the posterior capsule was also noted on histopathology samples. Clinically, These capsules appear crystal clear many years after primary surgery. To summarize, with cataract surgery being offered at a much young age and therefore longer lifespan with artificial prosthesis in the eye, such long-term complications are going to increase. We ophthalmologists need to keep this in mind when offering any surgical intervention to our patients. These are some of the references for this topic. Thank you for watching the video.